a lot of times doctors will have this in their office, they'll have this in clinical outpatient laboratories as well. This is the litmus paper for the urine analysis is like a pH paper. So the strip that you see here in the middle, this is all normal. These are the colors that it should be if all the readings are normal. However, if they become abnormal due to whatever in the urine, see this is one of the, I don't know, can you get this, Dave? Can you see this? This is a typical urine dipstick. You set this in the urine for about 10 to 15 seconds, and then you take it out, shake it out, and set it on paper, let it dry. These usually will show immediately if there's any type of color change. And what these look for, what these can actually test for, are the following. We have leukocytes, which are your white cells, right? Nitrite, urobilinogen, protein, looks at the pH of the urine, blood in the urine, or hematuria, specific gravity of the urine, ketone, bilirubin, and glucose. Now, in our earlier lecture on diabetes, we said that glucose, ketone, and proteins would spill into the urine if somebody was in diabetic ketoacidosis, right?
Yeah.
We said if their body started to burn muscle, for the sugar, and start breaking down muscle protein, then nitrites, proteins, and ketones would spill into the urine. Consequently, people that are cachectic, have anorexia nervosa, even after weightlifters have worked out, or someone who's doing very physical, strenuous activity, you may see protein and ketones in their urine. But obviously, if someone is in diabetic ketoacidosis, you're going to find also glucose, right? So a less invasive test, but it's not as specific for whether or not you have glucose. Oh, yeah. Okay, go ahead. No, go ahead. Would be to do a urine analysis, right? But here's the thing. You got to have a lot of sugar in your body for it to spill over into your urine. You have to have a lot of sugar. If you had a glucose of 145, it may not spill over into your urine. If you have a glucose of 400, yeah. So, but diabetics shouldn't let themselves go that long and not checking their sugar. So these are results that you can get immediately in the physician's office if you have to do a dipstick, okay, for urine analysis. And then you just take the stick that you dipped in the urine and match it against the concentrations of these different colors. So I'll pass this around so you all can look at it. There's a lot that urine can tell us. Typically, hematuria should not be there. We shouldn't have blood in our urine, okay? People may have blood in their urine for different reasons. On some cases, it might be bladder cancer, worst case scenario. Sometimes people get what we call interstitial cystitis. So certain foods can cause a reaction in the bladder and cause spasms. So typically white cells shouldn't be in the urine either. That usually shows a sign of infection, maybe a kidney infection. So you notice that some of the things that we're looking at we're looking at kidney functions, because if you look on your lab sheets, you'll see that bilirubin, right? I think bilirubin direct is liver, bilirubin total protein. So, I mean, something's going on with the liver as well, liver and kidneys. I've also, so that's pretty straightforward, the urine dipstick, urine analysis. What I've brought in is a PT-INR monitor. And when you do home care, if you do home care phlebotomy, you will probably be doing PT-INRs. And what this is a machine that will tell you whether or not the patient's Coumadin is actually working. Now, what did we say a PT-INR should be? Do you remember? Between what numbers? This is a PT-INR machine. And this is a simple finger stick. Now, the strips for the PT-INR,
I didn't write it down.
I thought I brought some strips
I
here.
don't think we wrote it down.
Okay, well, I'll go over it in a minute. Let me go over that.
It should be between 120 and 160, but I think you said 117 and.
I think you're thinking about glucose. Yeah, let's do this. Let me just erase this. It's fine. Let's talk about a PT-INR for a second. This is a nice review for your phlebotomy file next week as well. So when we do a PT and or PTT, it's going to be in the sodium citrate preservative tube, right? The light blue tube?
Yes.
So we said that if they're on Coumadin, we're going to do a prothrombin time. If they're on heparin,
We're going to do PTT.
a PTT, right? So a PT-INR. Typically, we said for anti-embolytic therapy, normal blood clots is usually for a person on not any therapy at all. Their blood should clot in less than 50 seconds, generally, right? But for people that are on anti-thrombolytic therapy, the therapeutic range is between 53
and 85.
to 85 seconds, right?
Yep.
Okay. That translates into an INR, international normalized ratio, between 2.3 and 3.5 unitless. There's no units associated with that number. Now, the PT-INR strips are quite expensive. They're like $7 to $8 a strip. And basically, let's see if I have these strips in here. I have to go next door and get some. Basically, what happens is you turn this on, and then you're going to insert the strip. And it's very interesting. The strips are very interesting to look at. They look like the starship, Star Wars. You insert it in here. You insert the strip in here, and then you'll put 1 drop of blood on the strip, and then you let it count down, and it'll tell you whether or not it's in range. If it says error, it doesn't tell us that. The error just means their blood might be clotting normally and not in the therapeutic range. Their blood might be less than 53 seconds, and they may need to have more Coumadin or increase their dose. An error may tell us, so an error message may tell us that the blood is clotting in less than 53 seconds, or it may be taking longer than 85 seconds to clot, in which case the dose may need to be lower. In that case, when you get an error message, what you need to do is to call the physician and ask the physician if you need to do venipuncture, because he's probably going to want to know, proof positive, what the patient's prothrombin time is, to know whether or not to increase or decrease their current dosage of Coumadin. Okay? So these little PT-INR machines are very handy to take to people's homes to do PT-INR tests on them. The only thing is you have to get the drop of blood to drip. So it's got to be a real big drop of blood to drip right on that dot, because the blood will go up and go around and go through like this maze. And if you don't have enough blood, it stops. And then you have to do it again, so you waste a strip.
Which shouldn't be a problem, especially if they're on some sort of a blood thinner.
Typically, correct. So again, with finger sticks, you want to make sure your hands aren't cold.
Testing on an older woman who's got really cold hands.
So I was going to
Warm
say, I'm
them up.
going with the cold. Yeah, you want to have them hold on to a warm washcloth just for a minute or so to warm up, and do this a couple of times to get the blood flowing. Yeah, because if they're cold, that blood's going to coagulate really quick. You're not going to get a lot. You really need a big drop for this PT-INR. Okay. If you take a look, I have some stool tests for stool cultures, for blood in the stool, for occult blood meaning stool. And
You're
there's
not gonna answer the one.
no volunteers for stool cultures. Thank you, no. Thank you, no. But there's a solution that comes with this test, stool for occult blood. And basically you prep this area, well actually you prep the back area with a solution. You put the solution on here and you swab the stool here. And if it turns blue, it's usually positive for occult blood. And they also give you these nice little, oh, these are just so handy, aren't they? These little popsicle sticks to rub the stool. Does that sound like fun? So, you know, you can test for occult blood in the stool with these right inside the doctor's office, put the patient's name, etc. And he can ascertain that and determine what other tests need to be run.
Yeah.
When you say prep, how do you prep it?
Well, here, you open this up from the back, and then there's a solution. And you put
Okay.
this solution on it,
Okay.
then you put the stool here,
Okay.
close it. If the solution, then if this turns blue,
Got
we
it.
have stool, we have blood in the stool.
Okay.
Okay? So it's kind of like a reaction with the blood and the iron. It'll turn it blue if there's
So
blood
how
in the
different is
stool.
that than the, say the 4 vials you're supposed to put the samples in, the test, and 4 or 5 vials, I'm not sure what those tests would be for.
I'm not sure, they might be looking for guaiac.
Because,
Sometimes we do samples for parasites.
I was working midnights at Metropolitan in Grand Rapids. A patient came in about 2 in the morning. He had his stool collection bag, and the caps were loose, and the whole bag was filled with fluid, and no one wanted to get close to it. So, and
Wow.
I don't know what he was supposed to get samples, and apparently didn't screw the caps on good enough when he got them, either on purpose or.
Well, it could be a number of things. I mean, C. diff, they might be testing for C. diff. They might be testing for parasites, ova parasites. Sometimes we do stool cultures for that as well. That wouldn't suffice. That's mainly for occult blood. So with the ova parasites, I think that's probably more along the lines of what they're looking for. And or C. diff. So PTINR machines, they're nice, they're handy, but you're going to go through a lot of strips if you don't get enough blood. Now, some of you asked some really good questions during lunch about the different duties and the different divisions of laboratory. And I'd kind of like to show you some of the divisions of lab. When you're working in a hospital, there's a lot of divisions of lab. For you, as a clinical laboratory assistant, you're basically working in serum chemistry and or microbiology. Not so much microbiology, but mainly the serum chemistry, where all the bloods, all the tubes, all the phlebotomy tubes that come in, you're using, you're helping the medical technologists. So if we take a look at some of the different labs, we have serology, also known as serum chemistry, or just chemistry. This is all the same, nomenclature, for the same section of the lab. Okay? We have hematology. We have blood bank. We have histology. We have cytology, which is a division of pathology. This has to do with tissues, this has to do with cells, this is blood banking. These are your lavender top tubes, right? We have microbiology, where your what? Blood cultures would go. Okay. We have, let's see, blood bank, cytology, hematology, serology, microbiology. actually in serum chemistry, they just go ahead and do urine analysis down there too. They don't really make a separate lab for
You
that.
said coagulation?
Coagulation, thanks Denise, that's what I'm looking for, coagulation. What goes in coagulation? What color tubes?
Blue?
Blue, right, light blue. What's the preservative?
EGTA?
K2.
K2.
No, not
Blue
the-
top, light
No.
blue.
Sodium heparin.
Coagulation.
Oh. No, is that EGTA? No.
No. Sodium citrate.
Oh.
Right? Sodium citrate. Hematology is what? K2, EDTA. Blood banking, K2, EDTA, right? In serum chemistry, we don't have a preservative, we have a serum separating agent, which is made out of silicon, right? So these are just some of the divisions of lab. And if you walk into the lab, it says lab, and then you walk in, there's doors on either side of you, and they all have their little titles on where you're going to be working. Okay? Now, what I also brought in today, we were talking about drug tests earlier. These are the instant bluing tablets for the toilet. Why do we put those in the toilet?
So people can't try to dilute their urine.
So yeah, so you know how they say don't flush the toilet when you have a drug test and they make sure all the water is shut off. These blew the water, and they really do. They really blew the water, so that if you were to put anything other than water inside of the toilet that has a different pH, different acidic content, it'll change the color. And they'll know that, I mean, if you try to use I don't mean it that way, but it will change the color a little bit, but if you try to, you can't use the urine, you can't use the toilet water to dilute your urine, basically.
Oh, people do it?
Now, I have had a drug test done before where the technician stands in the room with you when you go.
Yeah, and I just think that's stripping you of all your rights. That's just unfair. I don't think anybody should watch anyone. That's just wrong. That's so wrong. I never did that even during, I shouldn't say this on here. Let's just suffice to say that it's not right.
I mean, because I've had several done, but I did for our adoption. Like, when I had to go to Livingston County, like, the lady went in the room with me and watched me
Right.
give the
Well,
specimen. But then didn't my husband.
and then what, I'm sorry?
She did not with my husband.
Really?
Wow.
Because think about it, there are things you can hide in your orifices down there that seriously, I have seen from being a sitter and watching some psychiatric patients, there are things you can hide in those orifices down there in your vaginal cavity that men cannot. Men only have one hole, and that's their butt.
That's okay.
Sorry, not to get off on a
I
tangent.
That's okay.
know of a certain
I just watched on.
mechanism you're able to buy at the certain head shops that attach to your waist and
Warms up the urine,
warms up the urine, and you can use that to give a sample.
because it has to be 98 degrees. A lot of times for the drug testing, we have a temperature strip on there, so if the urine isn't the right temperature, it has to be rejected.
So if someone was not watching, maybe
They could do that.
change it and
Well, the way I look at it, my philosophy is this. If you're going to go ahead and go to that extent to do that, more power to you. I
Right.
don't know. And go for it. I mean, as a healthcare provider, I'm not a policeman. And I would never put myself in a situation to humiliate someone
but I
else.
think they're made in such a way that you can actually do it with someone standing right behind you and they never know.
Okay, this is for venous blood gases, finger stick blood gases. If you pass this around, you'll see it's heparinized, so in there's a little bit of heparin. You titch that to the finger once you've made a capillary puncture and wipe away the first drop of blood. There's lithium heparin in those. And then you put them in wax, and you put them in ice, and you run them down. You always have to put blood gases in ice. So blood gases, venous blood gases, versus arterial blood gases are two, they have different values.
Is this where the little black spot dot
Yep.
is?
Yep.
Is it like on the inner side, like coated around it
Yes,
though?
it is.
Okay, so
Yeah.
it's very hard to see if
It
there's any liquid in
is,
there.
it is, and these come right out of this little hole in the top of this container.
Oh my gosh.
These are for microhematocrit,
Yeah, I've seen one of these.
for
It
putting
gets
a
all the
drop of
in
blood. These
there.
are tiny,
Yeah.
tiny little
That's really-
finger stick collection pipettes. They're so tiny, they're very cute. I want to show you. Look how tiny that is. It's to take a drop of blood from the finger that you have and then drop it on whatever you need to drop it into
The proper
for
drop.
that. So it's very neat.
I remember when I was testing once
It's
at
like
a
what they got at
big
the
run,
lip office.
we're using these type of pipettes with,
Blood from the kid.
doing the finger stick and get the blood with you for cholesterol testing.
Yeah, we have a microhematocrit machine that runs those as well. Okie doke. So I'm looking right now at your clinical laboratory assistant quiz. This one right here. Not the two that I gave you,
Yeah.
but this one. This one that starts out with, lists 4 different chemicals found in the lab. So let's kind of go over this, because this kind of sums up pretty much what I go over in clinical laboratory assistant class. So let's go ahead and take a look at that. Okey doke. So 4 different chemicals that are found in the laboratory.
Ethanol.
Sodium hydroxide, potassium hydroxide, sodium bicarbonate, which is what we use to clean up certain acid spills, hydrochloric acid, potassium permanganate, sulfuric acid or dihydrogen sulfate, ethanol, methanol, and hydrogen peroxide. H2O2 is hydrogen peroxide. So those are just a few of the chemicals that you'll find in the lab. What happens when you mix an acid and a base? So it has to be a strong acid and a strong base. You get a salt and a water. You get 2 harmless byproducts of mixing 2 harmful chemicals. Now that's not to say that if you have an acid spill, that you're going to take a very powerful base and put it on the acid. That's not what we're going to do. But in a laboratory, if you were mixing, in a controlled environment and a strong acid and a strong base, you would get a salt and a water as a byproduct. So 2 totally harmless products. List the lab tests that are included in a lipid profile. Well, this is coming from your lab sheet, right? So this is a good review for even your test next week. In 1 tube, if you do a lipid profile, you can do triglycerides, total cholesterol, high-density lipoproteins, and low-density lipoproteins, right?
Right.
And we got our triglycerides. So all those can be done in what? 1 tube, right?
Yeah.
1 serum separator tube. Now number 4 says put the following chemicals in order of greatest flammability. Okay? The answer is on the second line. Methanol would be first, ethanol would be second, and crude oil would be third. Because remember I said that you could take a lit match and put it in diesel fuel, and it would just probably, snuff it out? Or if you are able to light diesel fuel, it takes a very long time to burn. And once it starts burning, it burns for a very long time. That's because the molecular chain is so long and so heavy, and it's made of multiple double bonds and triple bonds. So it takes longer to break those bonds because the bond between a double bond is stronger than that of a single bond. The bond between a triple bond is stronger than a double bond. So when you have doubly and triply bonded carbons, it takes more energy to separate those. And that's why it takes longer for heavier molecules to burn made of carbon. Okay, can we give a brief explanation of the duties of a laboratory assistant? Don't look at your test. What can you tell me? What are some of the duties? Brian?
Assisting the technologists setting up certain tests.
Okay, assisting the laboratory technologist in setting up tests.
Calibrating equipment.
Calibrating equipment, very good, Kelly.
Monitoring the quality control logs, or the quality.
Very good, Kelly. Maintaining quality control logs, excellent. Keeping the lab clean. Very good. Excellent. Okay. Okay, now, what type of education does a clinical laboratory technician have? A technician,
Bachelor in,
Bachelor of Science. All right, let's talk about sulfur for a minute. I've always found that sulfur is kind of a fascinating chemical, and I'll tell you why. As an environmental engineer and a certified hazardous materials manager, sulfur is one of those chemicals that if you smell it really strong, you know how they have the gas? Michigan has gas tainted with sulfur, so just a little bit, so you can smell it. It smells like sewage almost.
rotten eggs.
Rotten eggs.
Yeah.
There you go. That's so you are alerted if you do smell it. Okay. If you smell that rotten egg smell, you have a gas leak. But in high concentrations, what sulfur can do is paralyze your olfactory senses. So if you smell sulfur really strong at first, and you're in an area, typically you smell this near a waste water treatment facility or by a landfill, and then all of a sudden, a couple minutes later, you're not smelling it, and you're wondering why, get out. Go back, just follow the same steps out as you came in, because sulfur is interesting. It will paralyze your olfactory senses once you smell it really strong, and then you can be dead a few minutes later. So that's the thing about sulfur you want to be careful about if you ever smell it. And that's only if you're out by a landfill or a wastewater treatment facility. Okie doke. Why are quality control logs necessary? Anybody? Without looking at your test, why do you think they're necessary? Why do we keep quality control logs like we do here?
That's to monitor and make sure everything is like working properly. Isn't that what's used when you get like a lot of tests in, that you would mark the lot, the manufacturer, everything, and then you would do your positive, negative to make sure that it's calibrated and like working properly actually.
So good. That was wonderful. Yeah, that was excellent. It's a protocol that we follow, isn't it? And when we follow that protocol to make sure that the tests are correct, and that when we do tests on patients, that we try to get the optimal results, right? Just like when we talked about blood cultures. Can you remember what we said about blood cultures? When we collect blood cultures as a phlebotomist, what are some of the things that we have to do extra? We're collecting blood cultures. What are we doing? What do we do to the tubes? How do we clean the area when you're doing blood cultures? What are we doing? Beta alcohol, clean the tops with alcohol. How about when you clean the patient's arm? What are we cleaning it with? Chlorhexidine or betadine. So when we prepare the blood cultures, what's the one thing we want to keep them away from? Sunlight, right?
Right.
Don't put the blood cultures in sunlight. What does sunlight do?
Breaks down the stuff inside the tube.
The RNA, the DNA, if it's viral, right? It's going to break it down and it'll destroy it. So you may have collected an optimal sample, but because you've left it on the what? On the windowsill to let the sunlight get in, the ultraviolet light will break down what's ever growing in that or whatever's supposed to grow. Okie doke. So when performing an HIV test on a client, what must you be aware of and what steps must you follow? What about,
I would think universal precaution would be one step that you would follow.
okay, universal
With
precautions?
Everything.
And how you talk to them.
Therapeutic
how you communicate with them.
communications.
Very good, yes. What do we call that kind of communication?
Therapeutic.
Therapeutic communication, right? Very good. Okay, doke, a 10-panel drug screen tests for, and there they are, everybody, cocaine, amphetamines, methamphetamines,
Marijuana, methadone, opiate.
tetrahydrocannabinol, that's a mouthful, methadone, opiates, phenylcyclidine, barbiturates, benzodiazepines, and tricyclic antidepressants. Some of the divisions of laboratory, well, one of those divisions I forgot to list was toxicology. Hey, what color tube for toxicology?
Great. alcohol test is in
Right.
there too.
Oh, toxicology.
I'm just gonna step over here.
Hold on. No.
I'm gonna let you guys think on this.
Right.
Wait, give me a second here. Toxicology, if I have something toxic in my system, let's talk about the toxic metals.
Royal blue.
Thank you. I know that, yeah, I didn't hear you.
When you say it
You've got
that
such a
way.
soft, quiet voice, you need to shout out. Okay, thanks, Brian. You know, you may thinking of toxicology, like forensic toxicology, maybe you're looking for carbon compounds and things like that. That is a division, but if we're looking for like toxic metals, I should probably emphasize toxic metals
Yeah,
on this.
right.
So I'm gonna give you guys a pass on that one.
Thank you.
Number 22, why wouldn't you use alcohol? I mean, why wouldn't you clean the alcohol breathalyzer with alcohol pads?
Because
Right,
those
give a
bubbles,
false positive.
It will, right? So they may not have had any alcohol, but if they
from the,
blow into the machine that's already got alcohol on it, it's gonna show false positive for it. So we don't wanna do that. Okie dokie, you just spilled a gallon of acid. You're not gonna stay in that room and clean it up. You're gonna get everybody the heck out of there, right?
Yeah,
Because what could happen?
Houston, we have a problem.
What could happen?
Yeah.
Could die.
right.
Asphyxiate. That is what we call what? An immediately dangerous to life and health, right? Okay, because ethanol is heavier than air. It displaces oxygen. Oh, this is the answer. So, but ethanol is not an acid. So, 26. List the data that's normally required for a quality control log. Give me 1 second. To the HIV test card prior to adding the blood. What's the purpose of that?
Just like priming the paper.
Prime the paper. Very good. Why is it important to check the temperature in the refrigerator?
It needs to be between 38 and 42 degrees. for
Yeah,
optimum stuff.
38, 42. That's good. What are the tests in a chemistry profile? Here you go. Take a look at those tests and count them. If there's 14, that's your basic comprehensive, that's your comprehensive metabolic profile. Let me just shut this door. If there are 14 tests, that's what your comprehensive is,
13.
right? So 14 tests.
This is 13.
Well, what are we missing then? It's 13.
3, 4.
Let's see, 1, 2, 3, 4, 5, 6, 7, 10, 11, 12, 13, 14. No, BUN and creatinine are two separate tests.
Do I know that?
I got
Oh,
14.
I said 12.
How did you get 14?
Okay, so I got
13.
glucose is 1,
Yeah.
albumin is 2, SGOT is 3,
Yes.
SGPT is 4.
Yes.
Direct billing.
Direct billing is 5.
Direct should be total billing. This should cross direct billing out, put total billing. It should be total bilirubin.
Okay.
Alkaline phosphate is 6,
Right.
sodium 7,
No,
I'm sorry, potassium 7, sodium 8, chloride 9, CO2 10, BUN 11, creatinine 12,
Calcium.
calcium is 13,
13.
total protein is 14. So put TP in there. So total protein. Okay? Number 30, why is it important to measure blood gases? Well, blood gases tell us, remember we talked about diabetic ketoacidosis? And we looked a little bit about the pH and how enzymes are important to lower the activation energy of a reaction so we don't heat up, like I was doing just a few minutes ago. I was heating up, didn't have enough enzymes participating maybe, but the thing of it is, blood gases tell us where we're at in the body's metabolism. Usually if we're doing blood gases, it's usually not a good sign for the patient. They're usually not, I don't want to say taking a turn for a worse, but their body is trying to compensate for something that's going wrong. So for instance, somebody who's in a very ketotic state or an acidotic state, their body's going to try to counteract that by producing more bicarbonate ion. The pH is going to try to balance itself out. Your body tries to regulate itself as best it can until it can no longer regulate itself anymore. So we have like 4 different kinds of metabolic and respiratory acidosis and alkalosis. We have metabolic acidosis and alkalosis, and we have respiratory acidosis and alkalosis. And so when we do blood gases and someone is, not doing very well, we'll usually do arterial blood gases to check what their arterial blood gases are. I don't usually see capillary sticks for venous blood gases too often. Usually if we're doing blood gases, they're arterial, and we got to get them down to the lab quick, put them on ice and run them. When I used to be a ward secretary, I'd have to participate in codes. I'd have to leave my desk, go down the hall with the doctors and nurses, participate in the code by writing down the medications, and then I would have to run the blood gases. They'd say, Nancy, here, take this down to lab. Take these blood gases now, because we needed to get those values back, okay? So blood gases really tell us what's going
When I
on.
was working in a hospital, we never did the blood gases, the EKG techs did the blood gases.
Respiratory therapy does blood gases. I don't know if I don't think EKG.
Okay, maybe.
I'm thinking the respiratory
somebody
therapy do
Somebody
the
with the tech that
EKGs.
never came around and
Yeah, because we have a lot of respiratory therapists that do the EKGs. They're also the
they
ones
also
that
had a
do the
vent
blood
unit in the
gases.
hospital, so.
You what?
They also had a ventilation unit in the hospital,
Okay.
so.
So the blood gases consist of your pH, your PCO2, your pressure, your oxygen pressure, and your bicarbonate ion. List the 10 components in a urinalysis test and give a brief explanation of each. So we went over basically what the urinalysis test consists of, and the different, like for the protein and things like that. If there's a lot of protein in the urine, then either someone's been doing extremely strenuous physical activity, proteins and ketones, but also they could have, they could be in a diabetic state. 32, explain how to collect a clean catch urine. And that gives you the step-by-step instructions there on how to do that. Okay? Also how to explain how to do a clean catch urine for a male. So when you ask when these people come in for clean catch urine specimens in the lab, because you'll be doing a lot of urine tests. It's phlebotomy, it's not all blood. You're doing lots of urine tests, believe me. You need to explain to people how to collect a clean catch if they don't know. So you need to ask them, do you know how to collect a clean catch? If they don't, find a place where you can privately tell them, not in earshot of everybody, how to do it, because they have to clean the area, okay? Okey-doke. Number 33. Upon applying the chemical reagent to the stool card, so we're talking about these right here, stool for occult blood, what color will it turn if the stool is positive for blood? Blue. Okay, let's take a look at the next question. Factor 5, 9, and 10 are blood tests that look for specific clotting abnormalities. What color tube will this test be done in? Light blue. Any special preparation needed? These are always your factor studies are fresh frozen, right? If they're fresh frozen, you're going to always fill these tubes completely so that the ratio of 0.3 mLs of preservative of the sodium citrate will be
That must
matched.
have been the other test in the blue tube that I was thinking of.
What's that?
I remembered that a different kind of test was done also than running a blue test.
Oh, the factor studies. There you go.
Maybe what I was thinking about.
Yeah, factor studies.
And then you
So-
freeze it?
And you freeze it. Put it in a biohazard bag, freeze it. Patient's name on it. The fresh frozen specimen. What are we trying to do? Remember I talked about that. You have a clotting cascade, right? And you're at the end of your clotting cascade. Oh, thank you so much. At the end of your clotting cascade, you have a protein that's produced called fibrin. This is the last product of your clotting cascade. So we've got collagen, fibrinogen, plastin, thromboplastin. You recognize these from your PT and PTT, right? We also have factors, so we've got factor 5, 9, 10. So all of these participate in this really intricate clotting cascade to give us this network of fibrin. That's the final protein that forms that clot. It's a fibrin clot. But what happens along the way? There's a lot of participants in the formation of fibrin, like a lot of your clotting factors, which is why we freeze the specimen immediately to kind of slow down the coagulation cascade so we can identify who's missing. So fresh frozen, that's why we freeze it. Okie doke. Your patient has a PT-INR of 3.8. What is the best explanation for that? So what did we say the norm was for PT-INR? 2.3.
2.3 is 3.5.
So where does 3.8 fall?
A little elevated.
So what would you expect with a 3.8?
Call the doctor.
Okay, call the doctor. Are they out of therapeutic range?
Yes. So.
Is it taking them too long to clot, or they're clotting too quickly?
Their blood's too thin.
It's taking too long to them.
It's taking too long to clot. Very good. Yes, Ebony. Right. The blood is thinner, right? So I believe a 3.8, you wouldn't see that because this would give you an error on the machine if it's higher than 3.5. But I just want to ask this question so you can put it in perspective as to where these numbers, what these numbers actually mean, okay? What would you think the significance of pale red blood cells would indicate? Instead of bright red blood cells, they're pale.
Not as much iron.
Okay, which translates into what type of disease? Anemia. Good job. Your patient has a white cell count, of 40,000. Can you explain? Is this normal? 40,000?
No.
White cell count should be below 10 typically. Okay, 40 is pretty high.
They're probably running a fever.
Could be running a fever, but that high.
Start infection.
So they have an infection, right? Good. And the white cells of our body, we've listed them here, your lymphocytes, your eosinophils, basophils, neutrophils, and monocytes, okay? So this should actually be a little bit of review for you, in addition to some new information. Am I correct?
Correct, yes.
Okay. Now I'd like you to turn to the one clinical laboratory answer sheet with the underlying answers that you have on one of the other sheets that I handed out to you. You could take a look at that. This takes a look at some other aspects of clinical lab. And actually, one of my former teachers that worked here, who's now working in dialysis, had us make this out. A random urine. When we talk about a random urine, it is at the most requested urine sample that can be collected any time of the day. It's random. We don't need a first morning specimen, right? We don't need, any particular type of specimen. It's just a random urine. A midstream, the most requested urine sample that can be collected at any time of the day. The specimen in which the patient collects the middle collection of the urine flow. So midstream, right? That's what we were talking about. Timed urine, it's pretty obvious what a timed urine is. A clean catch. So typically you see number 2 and number 4 used together, midstream, clean catch, right? All urine must be collected in leak-proof containers as a form of observing universal precautions. Now take a look at 6, formalin. That's a chemical that we haven't really discussed too much. It preserves the formed elements, formalin. When we talk about formed elements, what tube are we talking about? We talk about formed elements. Formalin preserves formed elements. When I showed you a serum separator tube and we centrifuged it, and we saw the serum, and then we saw the clot that formed from the silicon. Underneath, we saw the buffy coat of the white cells. And I said, below that is your formed elements, right? Your red cells.
Right.
So formalin preserves the red cells. We also use it as a fixating agent on slides. HCl is an acid.
So you're gonna use that in the gold tube.
No, that's where you find the formed elements in the gold tube, but formalin itself we use to prepare slides with. So these slides right here, let me show you. See these slides? These are microscope slides. And if I want to prepare a microscope slide and I want to set something, formalin will set the red blood cells for me
Okay.
on here. The formed elements are our red blood cells.
But formalin is what is used to preserve the formed elements. In a formed element, you can
On a
find that
slide.
normally in a gold tube.
You can, but there's
Okay.
no formalin in a gold tube.
Correct.
You're correct though.
There is no formalin in a gold tube, but if you're going to draw up the formed elements, you're going to do it in a gold tube, then you're going to bring it back, and then you guys are going to use formalin to
Set them.
Got it. Sorry.
No.
So I had to go through the
That's
process.
good.
Does it
Good
preserve,
process there.
does it preserve the red cells?
It does. So we can look at slides,
Or does it set up?
both,
Okay.
okay? HCl it preserves the calcium and phosphorus in tests. 8, sodium carbonate preserves porphyrins, okay? Porphyrins. Again, we're talking about hemoglobin. P-O-R-P-H-Y-R-I-N-S. Porphyrins. That heme molecule with the iron right in the center of it, the porphyrin complex. Sodium bicarb preserves that. So sodium, I'm sorry, not sodium bicarb, but sodium carbonate will preserve porphyrin. So it preserves the hemoglobin. Okay, preserves the hemoglobin. Boric acid preserves formed elements and creatinine in uric acid.
So is that answer both of those?
Yes. Formed boric acid can preserve formed elements and creatinine.
Okay, so what point in time would the person use boric acid over the formalin then, regarding the formed elements?
I'm not sure, boric acid would be more for tube samples, whereas the formalin would be more for slides.
Okay. Thank you.
True or false? Oh, it's false. It says Bowman's capsules empties into the collecting tubule. That is false. The distal convoluted tubule of the kidney portion of the nephron receives the glomerular filtrate. That is false. Kidney is the organ where the urine is formed. That's false. That's true. I'm sorry. Nephrotoxic or nephrotoxic means destruction to kidney cells. I don't know who phrased these. That is true. If something is nephrotoxic, it is dangerous to the kidneys. The ureter is through which the urine is discharged. That's actually should be true.
That should be true.
That's not false, that's true. And the urethral canal is the tube carrying urine to the bladder. Okay,
That's true.
That's true, yeah, those are wrong. LDL is bad cholesterol, that's true. Optic checks confirm that the light source and light sensor and optical analyzers are working properly, that is true. Now, where do you find optical checks for analyzers? Your thyroid stimulating hormone test is one, your lipid profile is another. We have tiny machines that use optic analyzers. Once the controls are open, they're good for how many days?
90.
Yes. And what else do we do? What do we have to do when we open a control?
You have to
Date
date
it.
it.
Log it and do it.
Date it, put your initials,
Yeah.
okay? The composition of water and urine is 95%, that sounds right. BU and creatinine are important serum tests for monitoring kidney function. I believe that's true. And let's continue onward and take a look at this. Acetone is colorless, it should be flammable. Acetone is very flammable. It's found in blood and urine. No, acetone is not found in blood.
Just found in their sweat for diabetics, you said.
And diabetics, from the breakdown of fatty acids. I'm not so sure about the blood, but definitely urine and sweat.
So it's flammable and
And urine and sweat. It's not inflammable. You put a match to acetone, you're gonna have a problem. Aegis is an agency for sponsorship and protection. So all those should be capitalized. AEGIS. Body fluid, any secretion or excretion from the human body such as vaginal, cerebrospinal, synovial, pleural, pericardial, peritoneal, amniotic, and sputum and saliva. Excretion, the elimination of waste from the body. Waste matter, elimination of waste products from the body. 26, calibrations, determine the accuracy of an instrument by comparison with an accepted accurate chemotherapeutic agents or agents used in treatments of diseases. Wait, this doesn't make any sense. Don't even worry about that. What does calibration mean when it comes to instruments, everybody? Calibrate something.
Make sure the
it's
machine's
working right.
Right, make sure it's working, like our centrifuge machine. I'm not gonna go on with these, just read them, because I think whoever wrote that particular test got some issues with it. When we calibrate the centrifuge machine, what are we looking for? What did I say the rounds per minute were on the centrifuge machine? Do you remember?
30,000.
3,500, it's a lot, right?
Yeah.
If the centrifuge machine is uneven, and even though we've balanced it, what could be going wrong? The ball bearings in the centrifuge machine. So it has to be recalibrated from time to time. Systems of weights and measures request that machines that are used for the public have to be calibrated every so often, just like gas pumps. If you go to the gas pumps, you'll see that it's inspected by weights and measures. It's inspected by a particular organization to be sure that the amount of gasoline coming through is correct. Even though we buy gold and silver, they have weights and measures that have to be calibrated by the State Department, okay? In the state agency in the state that they're being used in. So you can see basically what goes into a clinical laboratory system is not as demanding as the medical laboratory technologist. The responsibility on your shoulders is not as great as determining whether or not a phlebotomist made an error in, any pre-analytical errors that may go into a blood draw. But certainly your job is very important in making sure that the laboratory is clean, that the chemicals are properly stored, that we don't have chemicals that can react with one another next to each other or being stored next to each other, that they're stored properly as per protocol in dark smoked containers that are glass, in a cool environment, in locked cabinets that are at least 4 inches above the ground, okay? That you're going to be using controls at times that could be dangerous and toxic to you, such as the AIDS control. That you're working with tests that will help the general lay population get results immediately, which of course you can give back to them because they're what? Point of care tests, right?
Correct.
So you're able, within the scope of your practice, to give results to people for point of care tests. Can you tell me the difference between point of care testing and normal in-house hospital laboratory testing? Yes?
The point of care, they can purchase themselves and administer it themselves.
They can, which means that they can know what their results are even when we do them. Certainly, there's a certain amount of therapeutic communication and interaction that you have to have with your patients based on what results they may have, right? Obviously, when doing any type of finger stick, anytime you're using blood or you're testing body fluids, you would use what? Universal precautions, gloves, if necessary, gloves of course, gown, goggles, mask if necessary. Always wash before and after you take care of an individual. Certainly, making sure that your instruments are working properly, that you've done the tests and you've logged them into the quality control log to be sure that the controls are working and the batch that you pull a random test out of has passed the control tests. Okay? Maintaining the refrigerator temperature, as we said, the quality control logs, and just in general, making sure that things are running smoothly. A good clinical laboratory assistant is invaluable to a medical technologist, really, because they feel like the world is on their shoulders. And a lot of times they do have a lot of responsibility. They're the ones that have to catch the phlebotomist's mistakes. Okay? So in going over some of these tests, I think this also helps you with your final a little bit, right? What I'm going to do with the final exam is I'm going to put a prototype final online for you to be able to access. Okay? So kind of like a practice final for all of you. You can go online and you can do it. And I'm going to be working on that today. So what I'd like to do is close now and ask if anybody has any questions that they'd like to ask me.
Can we go back to the very first question on this clinical laboratory assistant, quiz number 1? You have all these different chemicals, but I'm not sure what all of these are broken down. So let's say we have this. Can we give you just the names, or do we have to give you all of these, like these numbers, like the numbers and letters?
No, you can just give me the names.
Okay, can you go back over what those
I
names are again,
can.
please?
I absolutely can. Surely. Let's go ahead and do this. Okay, so Kelly asked a question about some of the chemicals found in the laboratory. And she sees that the chemical nomenclature is in the formula form. So for instance, NaOH is equal to sodium hydroxide. And I don't care how you use it, or you want to spell it, that's fine. However you want to list it. The KOH, what do you think that is? Potassium hydroxide, right? OH is hydroxide. The NaCO3,
Is that sodium bicarbonate?
it's sodium carbonate.
Sodium carbonate.
This should actually be Na sodium bicarb. That's sodium bicarb. Well, we don't want sodium bicarb. This is baking soda. So sodium carbonate. Sodium carbonate. K2 MnPO4 this is a chemical that's used for double displacement reaction to test for water in petroleum chemicals. So I don't know if you're actually going to find this in the laboratory, but it is a handy little double displacement reaction for water, to test for water. So this is considered potassium, Potassium, permanganate. And then H2SO4 is dihydrogen sulfate. Sulfuric acid. there's your ethanol. Methanol we drew, right? Methanol is your CH and your OH. And then, of course, hydrogen peroxide. Hydrogen peroxide, peroxide, is H2O2. And methyl ethyl ketone peroxide, MEK, it's a catalyst. So MEK, ethyl ketone, H2O2. So that stands for methyl ethyl ketone peroxide. This is a very, I don't know if you really find that too much in a laboratory. That's actually used as a catalyst in plastics. So you don't really find that. I just thought I'd throw that in there. Because it's very flammable, extremely flammable. Whew. Okay. So there you go. The test is online. It's multiple choice for your clinical lab. Okay? So you can log in, and if you need login codes, you can come next door and I'll set you up. For those of you that don't have login codes, I'll set you up with some login codes to the website. But this pretty much concludes our clinical lab. Do you have any other final questions for me? Any questions at all? Anything? Okay. Alrighty, so those of you, we're all done here. Dave, thank you.